Hi, my name is Dr. Danielle Temin, and I'm a physical therapist and the owner of Revitalize Performance, which is a performance-based physical therapy clinic that specializes in helping active individuals, athletes, and runners return to their sport or activity pain-free. Today, I'll be sharing with you the top 3 exercises that I give my clients that are dealing with knee pain. Repeated knee extension is an exercise used in the prevention and treatment of knee pain. This exercise is going to focus on 2 things. So it's going to help strengthen the quad muscle, or the muscle on the top of the thigh, and this muscle helps control the position of the knee. And the second thing it's going to do is help the mobility of the knee joint itself, which is ultimately going to improve tracking. So for people who have pain with going up and down stairs, squatting, lunging, or even bending the knee, so heel towards the butt, this exercise is going to be a great stretch for you. So you can do this sitting on a couch, sitting on a chair. I'm going to do this sitting on the table here. You're going to sit up as tall as you can. I'm going to show you with my left leg. You're going to extend this knee out as far as you can. You're going to really push till you get to your end range. You're going to hold for 2 to 3 seconds, and then you're going to bring it back down. As you do this exercise, the purpose is to try to get your knee as straight as you can. There's no need to lift the leg up off the table. We're not really focusing on the hip with this exercise, just the knee, okay? So you're gonna perform this exercise for about 8 to 10 repetitions, holding for 2 to 3 seconds at the end range. And then if you'd like some relief with this exercise, you do this about 2 to 3 times a day. Isometric wall squats is an exercise used in the treatment and prevention of knee pain, especially if you're having pain with going up and down stairs, squatting, or lunging. So what you'll need is a sturdy wall or a door. You're going to get into a squatting position. So you're going to get into your comfortable squatting position, whether the hips are above 90 degrees or if you want to sit a little lower into your squat at 90 degrees. I'm going to start for my first set above 90 degrees. And my goal here is to hold for about 30 seconds to a minute. After that minute, I come out of that and shake out my legs for a little bit, maybe relax for 15 seconds, and then I'm gonna go back into a deeper squat position if that first set was too easy. And again, I'm gonna aim to hold for about a minute. If you're looking to prevent or maintain healthy knees, you wanna perform this exercise about 2 to 3 times a week for about 4 sets with a 15-second break in between each set. Sidestepping with a TheraBand is an exercise used in the treatment and prevention of knee pain. So what we're focusing on this exercise is the strengthening of the muscles of the sides of the hip. Typically when people complain of knee pain, it's with activities such as squatting, lunging, or going up and down the stairs. And what we see in those folks is that when they do those activities, the knees end up caving in slightly and putting stress and tension on the knee. And so if we can strengthen our hip muscles to allow our knee to be in a better position, we can kind of get rid of that knee pain. So for this exercise, what you'll need is a looped TheraBand. You're gonna place this TheraBand around the ankles, and you're gonna spread your feet apart so that way you have a fair amount of tension on the TheraBand. You're gonna get into a small mini squat position, meaning just kind of bend the knees a little bit and stick your butt backwards. And I'll show you what that looks like from the side in a second. So in this position here, we're gonna be taking small side steps, always trying to keep attention in the band. So small side steps to the side here, and what you should be feeling is some burning on the sides of the hip. So again, my position from the side here, butt goes back a little bit, knees stay bent, and I'm just sidestepping. So what you'll do for this exercise is you'll pick maybe a hallway or your driveway at home, and you'll go up and down that. I don't typically give reps or sets with this exercise. What I'll tell the person is just go until you feel a good burning in through the hips. Take maybe a 15 to 30 second break, kind of shake everything off, and then go back into maybe a second or third round of that, depending on how the hips feel. In order to get some relief and actually strengthen your knees, you're gonna need to do this about 3 times a week in order to see the benefits.